The Covid crisis, as we choose to call it, is creating a profound shock on all humanity. It's harming the health, the social, the economic well-being worldwide. But in midst of all this confusion, women are in the center of it. Yes, this pandemic is not gender neutral, as it has different impact on men and women. The reason could be because of the different biology and physiology, but also because of the different socio-economic roles played by men and women. Yes, it is a fact that the mortality is higher in men. It's about 60 to 80% more in men who contract COVID-19 infection compared to women. But when the income of a primary earner is lost due to death or disability, the caregiving role falls on the woman. She is left to take care of the family and prevent it from falling apart with meager resources. If you analyze the impact of the pandemic on women, it falls into specific, distinct categories. It could be health, economic, education, the invisible domestic force, and for example, the street vendors, and also a very high increase in gender-based violence and exploitation, which is seen whenever there is a disaster in the world. But the impact is maximum on the health sector. If you see the health workforce, it is predominantly female. If you take the workforce against the frontline workers, it is maximally women, according to WHO. Statistically speaking, 7 out of 10 global healthcare workers are women. 83% of nurses and 53% of physicians are women. The risk of contracting COVID infection is much higher in the health workers compared to the humanity they are trying to protect. So whatever the impacts of the pandemic, it is multiplied in the women. Another fact which is seen, which is worrying, and which is the talent drain, which will happen if women burn out and choose the families instead of their careers. It is not possible for them to fulfill the professional obligations as well as work as an unpaid worker at home. So, whenever we are thinking of solutions or responses to this pandemic, we have to base our policies on the unique role played by